Judge Nelson Wolff. I'm joined tonight by Dr. Lynette Watkins, who is the Chief Medical Officer for the Baptist Health System, along with our City Attorney Andy Segovia, and Medical Director Dr. Junda Wu. This is our COVID-19 update for the San Antonio community. Very quickly at first, we do want to say today's Texas Supreme Court ruling, which you may have heard about, was procedural. The Supreme Court did not rule on the merits of the case. Therefore, the city and the county will continue our appeal on the merits of the case in the Fourth Court of Appeals, and again on requirements for mask wearing, which remain in place at our local school districts. Do you want to go now to the case numbers? Today we are reporting 1,341 cases of COVID-19. Our 7-day moving average is now 1,126. We are sadly reporting 15 new deaths tonight. We've lost 3,817 friends, neighbors, and loved ones to this virus. Please continue to keep them and their families in your prayers tonight. It is worth noting that we have reported 40 individuals, so again, we continue to remind folks to protect yourself and your loved ones. Since August 11th, 32% of the deaths have occurred among individuals under the age of 50, with 17% occurring among those younger than 40 years. In the past, it was less than 10% of deaths occurred among those less than 50 years old, and 5% of those under 40 years old. And we know we have a tremendous amount of work to do to get vaccination rates up in the lower age groups. Over in the hospitals, there are 1,365 patients in area hospitals this evening with COVID-19. There were 160 new admissions in the last 24 hours with COVID-19. 394 folks are in the ICU. 342 are on ventilators. 87% of patients in area hospitals are unvaccinated. 29 patients are children. As far as vaccination rates, we continue to see some uptick, and that is good news. 67.1% of eligible Bexar County residents who are eligible have received at least one dose. Remember, there are about 20% of our total population are under the age of 12 and therefore ineligible to be vaccinated. So when you think about the concept of herd immunity and where we are with vaccination rates among the whole population, we're closer to about 50%. So we need to continue to work hard to get folks vaccinated. Let me now turn to Judge Wolff.
Well, while we're not happy about the Supreme Court ruling, the main thing is that the merits of the case will continue, in all likelihood end up back in the Fourth Court of Appeals, where they will have a hearing on the merits of the temporary injunction, legal documents filed, etc. So that's ongoing. The good news is that the schools, under the TEA provision that they're not going to enforce the mandate that the governor gave out that nobody has to wear one, and then the district attorney, Joe Gonzalez, stepped up today and said he will not try to prosecute any school official if they continue the mandates. I believe Northside School District stood up today and said they would continue. I believe Northeast stood up and continued. So I think most of all our school districts will continue to do that, and that's why we're in this battle. Now, almost all of them are pediatric cases. We see that going up, and so what we're doing now, and what we're seeing a dangerous time, not just because of COVID among the young, but RSV, which is another dangerous virus that's out there. Flu season will be started, so we're going to have a triple threat, flu, RSV, and COVID with young people. And that's why this mandate for masks set up by the school districts, they're doing the right thing, and I support them, and I know the mayor and I support them 100%. So that's going to continue, and hopefully nothing else will change at the state level that will stop that. That's why we made all this effort to file the lawsuits. That's why TEA is not trying to stop us, because litigation's going on, and we were here principally to save our children. And it's so distressing to see the governor of this state doing everything else that he can possibly do to stop us from saving them. So that part is good, and we'll continue to move forward on that.
Thank you, Judge. I also want to remind you to stay vigilant. If you do need a testing location, you can visit any of our 13 public sites as well as pharmacies that are located around town. You can find one of those public sites by visiting covid19.sanantonio.gov. You could also call the COVID-19 hotline, and that's 311, and then select option 8. In the meantime, please wear a mask and get vaccinated. Do it for yourself. Do it for your family, and do it for San Antonio. You can also get the latest on COVID-19 in our community by texting COSA-GOV to 55000 or by going to the website covid19.sanantonio.gov. Now, before we go to questions, it was a tragic day today in Afghanistan, and we want to offer a moment of silence on behalf of the service members who were killed by terrorists today in Afghanistan, along with the many others who were injured. So please join us in a moment of silence. Thank you very much. And we'll go to questions for Dr. Watkins, the judge, myself, Dr. Wu, and our city attorney, Andy Segovia.
Mayor, you said the merits will continue. Does that mean that the city and county intend to continue requiring masks in their building?
So again, I support where we are at now. Obviously, the manager, the county and the city are going to be examining the case and the opinion that was given by the Supreme Court, and we'll have more on that later.
This is for the. This is going to be for Andy Segovia. In late terms, can you explain what the mayor said and Judge Wolff is going to happen now? When you say the ruling is not on the merits, what is actually mean so the public that is not versed in law can understand a little bit better?
I'll give it a try. The Supreme Court lifted the temporary injunction on a procedural matter, which again, what they noted was that the status quo before we went to court in the first place was that the governor's order was in place. So they essentially saying because the governor's order was in place, that was the status quo, and therefore they don't want to disrupt that until there is a hearing on the merits. So in other words, that means our case that's currently in the Fourth Court of Appeals, that will continue. We have an option to ask for an expedited hearing, which we'll probably do. We're still considering what our legal options are. Another legal option is to ask for reconsideration by the Texas Supreme Court. But they did note that they did not make a ruling on the merits of the case, which means they did not consider all the substantive arguments that both us and the governor made, and are leaving that to the Fourth Court to make a further ruling on that.
So is this ruling the emergency ruling that they made today? Is this consistent with is something that we can expect from the Texas Supreme Court?
Well, yes, they again, it was a request from the governor for an emergency ruling to lift the temporary injunction, again, on a procedural matter, which is what was the status quo before we went to the district court here. And so, yes, that's not unexpected that they make a ruling on a procedural matter. Again, what we're looking at it as in the most positive light we can, which is to say that our case is still within the Fourth Court of Appeals, and we still have every opportunity to make our arguments to that court on the merits.
Do we have the latest numbers for students testing positive for COVID in school this year?
That information is downloadable to the public at the DSHS website. I think the last time we looked at it, there were at least 450, maybe 500 or so cases so far this year.
Can anyone explain why only 8% of hospital beds remain available, but there are 43% of ventilators available?
Well, we've got the hospital expert here, so.
Well, good evening. And not every patient needs to be on a ventilator. And although a lot of ICU level patients do need supplemental oxygen, there are different ways that we give oxygen to patients, particularly if they're in the ICU. And actually, we try to avoid, if we can, placing patients on ventilators because we know with this disease that the mortality rate increases significantly once patient is placed on a ventilator. Sometimes patients need low flow oxygen, sometimes they need high flow oxygen, sometimes they need a ventimask. There are different ways to provide oxygenation. So I hope that answers your question.
Thank you.
During a committee meeting today, y'all said that the region only has those 300 beds. Is that the same as the 8% capacity that the website is showing?
Who are you asking the question to, Lindsay?
Yeah.
So could you repeat the question?
Sure. Y'all mentioned today that 300 beds are available in the whole region right now. Is that the same as the 8% that the website is listing?
It should be. I mean, our available capacity should be reflective of the STRAC region.
That would be correct, although that is very much a fluid number. And we are constantly admitting and discharging and moving patients according to their condition to the appropriate status. So what may have been reported at that period of time is probably different now. Again, it just depends on the mix and the census of each of the facilities.
Dr. Watkins, can you talk about, I mean, a lot of parents are very concerned with their students going into the classroom, sometimes with 18 kids in the classroom. And can you talk about, the risks and also about pediatric cases that you're seeing in the hospital?
So we are seeing pediatric patients both with COVID-19 as well as other viruses such as respiratory syncytial virus. And we're seeing that earlier than what we normally see for a couple of reasons. At this time last year and even during previous surges, we were very diligent in masking and social distancing, and often our youngsters were not in school, they were virtual learning. And things had opened up between now and then, and we all got together. And with time, and I think that's part of the fatigue that we're all, have experienced, that we may not be as diligent with masking, distancing, and hand hygiene, and that affects our youngsters too. And remember, the COVID-19 vaccines, the one Pfizer is 12 and up, the others are 18 and up, but they're not authorized for youngsters younger than 12 years old. So we do have a significant number of unvaccinated youngsters that are in the area. So we are going to see these cases. What's the best way? Masking, washing hands, and social distancing. And of course, vaccination when applicable.
Mayor, you said yesterday that EMS units were unavailable to transport patients for a certain period of time. Is there anything that can be done to avoid this situation?
I mean, we sound like a broken record. Yes, mask up and get vaccinated. The reason why EMS units are being pushed past capacity is that they have so many additional runs in addition to all the things that they have to respond to, like trauma cases, heart attacks, slips and falls. And when you add on the extreme numbers of COVID cases, which are the highest they've been throughout the pandemic, then you reach a breaking point, and that's exactly where we're at. And that affects every single person in this community, because if you rely on an EMS unit and you need it at your worst moment, whether it's a heart attack or a car accident, it might not be there if we can't get the COVID numbers under control.
I'll tag on a little bit to that. Last week, I think we had our highest ever number of EMS transports. And what's happening in the hospitals is that they're taking them in and taking in more than I think they've ever taken in. But their systems are better. They know how to treat a patient now. The patients are younger, so they're able to not have as long a stay in the hospital as they have before. But a lot of patients are coming into the hospitals in the last 4, 5, 6 weeks, I guess it is.
45 deaths in the last 2 days. Mayor, Judge, how are you guys feeling about that, knowing that 100% of those were unvaccinated?
And keep in mind, 100% of them were preventable also. The governor and the AG do not appear to be interested in the health of Texans or the Texas economy. And we've said before, confusion is the enemy of the pandemic, and the governor is excelling at it. This is all preventable with very simple tools.
Yeah, it's just so distressing to see so many people that did not get vaccinated for whatever reason that they may have. And then for the for the governor to do everything he can discourage people from getting vaccinated in the businesses. He's done everything he can to stop employers from having their employees vaccinated. He's stopped all of us from doing that. The unvaccinated is a threat to each other. They're a threat to people that are vaccinated. You can still get sick being vaccinated. It's just the most bizarre thing that's happening. I think since we got the FDA approval for Pfizer, we've seen a lot of companies that are across in other states than Texas mandate vaccinations. We've seen the military do it, 1.4 million people. So I think you may see more of that, but he has done everything he can to stop employers and stop having their employees vaccinated.
What are the plans, if any, for Louisiana or East Texas hospital patients to be evacuated to our area in the event of a hurricane?
Talk about layers of complications. We will be visiting with STRAC about that contingency, but we've been through a hurricane before in the middle of COVID, and things are not going to be as simple as they were, say, a Hurricane Harvey evacuation. We're going to have to be looking at congregate facilities, which are not ideal. So the state ought to start booking hotel rooms for evacuations, because we cannot have people congregating in the midst of a surge like we're seeing. That would be completely negligible.
It's interesting to see.
Negligent.
It's interesting to see the state force evacuation, and at the same time, will not try to save people by having a face mask requirement in schools. It's rather bizarre. We did have people come here because they thought they were going to have a hurricane in South Texas here. I don't remember. I mean, I guess it was last year. And we had to handle a ton of people, you may remember, and we did it. The last time we had a serious thing out of Louisiana was when Rita hit, and we had, 20,000 people coming in here, but hopefully that's not going to happen in Louisiana.
Mayor, I was in Medina County yesterday, and they're having a problem with patients over there. They don't have capacity, and they're getting ready maybe to be overrun by patients. Is San Antonio right now, given the conditions, receiving patients from the region?
Yes, we are. About 20% on average around the region. Medina County would be one of them.
So is this putting an extra stress then on the locals, now that we know that we have more and more patients going forward?
Makes it more difficult.
But we have still capacity.
Well, we still have capacity, but it's always dependent on what's going to happen with your nursing staff and your medical staff. They brought in, how many, Mayor? I forgot how many they brought in, 200 and some odd, and they got a few more that have come in. So that's helped them a lot.
Yeah, so this is a statewide issue. I mean, every hospital system in the state is stressed right now, and a bed may pop up in El Paso that has to be filled by somebody in Kendall County. So they are transferring people all the time because the state is out of control with regard to the Delta surge right now. And so that's why if the governor is interested in helping support bringing the medical system back under control, he wouldn't be pushing this issue, and it would simply be using the tools that are available to us to stop the spread of this virus.
Tuesday, you mentioned that y'all have asked for 2,000 STRAC nurses and have gotten about 600 in the area. Are y'all expecting more in the next weeks?
Well, we've made a request of at least 2,000 nurses. I think as of Tuesday we had about 600, Doc, but
Yes.
only a couple hundred came to our system here.
Yes, we have received in Baptist Health System nurses from the state, and we are very pleased about that. Can we always use additional assistance? Yes, absolutely. But it has been helpful to have the state nurses working alongside our nurses and staff support, because candidly, everyone is tired. And we want to make sure that each and every patient that we take care of has the best care, and that often means some additional support. We want to be able to take care of those patients that have COVID-19 and those that don't, those that are here in this area and those that come from our rural partners. So we're working with the staff that we receive. We're grateful for them, and we're working hard to make capacity to take care of patients.
Mayor, is San Antonio prepared to receive refugees from Afghanistan?
My understanding is that the federal evacuation is not sending Afghan refugees to our joint base. That may change. We have not heard that, but that will be a federal operation if it does happen.
This is for one of the hospital experts. 1 out of 2 people hospitalized in San Antonio for COVID-19 have diabetes. Does that stat surprise y'all?
No, it does not. We do have a significant percentage of our colleagues in the community that do have diabetes. We do know that diabetes and other comorbidities do make individuals, whether they have COVID-19 or not, more susceptible to not doing well from diseases such as COVID-19. So, COVID-19 is also the great unmasker. We've seen that patients who thought that they were healthy had underlying conditions such as diabetes, high blood pressure, cardiovascular disease, peripheral vascular disease, and others. So, no, this does not surprise us.
With this ruling by the Texas Supreme Court, can the city and the county still ask its employees to mask up?
Again, what the Supreme Court ruled is they lifted a temporary injunction, which that means is we're back to looking at the governor's order GA 38, now supplemented by GA 39, to see what employers can do, what cities, municipalities can do, and we're going to take another look at that, because again, what the Supreme Court said is we're back to where we were, which is looking at GA 38, and we still haven't completed our analysis of that.
Dr. Wolff, can you talk about testing availability?
Yeah, as Mayor mentioned, we have 13 free testing sites that you can see at covid19.sanantonio.gov. It is getting busier, meaning it's a good idea to go ahead and have an appointment, but the appointments are all, when I looked at the website, for at the next day, not farther out than that. So they have excess capacity. There's still plenty of testing available for people who want to avail themselves of that.
I'm just going to go back to Mr. Segovia. And I'm sorry, this is pretty much maybe the same thing, but okay, the ruling is not on that. You're going to go back, look at it. So in the meantime, workers will be asked to mask up. The city and the county can do that, actually.
We've always, the messaging has remained the same. Mask up, get vaccinated. That remains constant. That's not going to change. We will decide probably tomorrow what we do in terms of what we're going to tell our employees and what we're going to tell visitors to our facilities.
That's all we have tonight. Thank you.
Thanks, y'all.
That was really good.
Thank you.